Hello and welcome to the program. My name is Marie Yambo. Our social media handles as usual at Marie Yambo at KBC Channel 1 on Twitter, KBC Channel 1 TV on Facebook. Now, hair loss is a condition that affects millions of people around the world. It can also have a profound effect on an individual's self-esteem. Now, today we want to speak about alopecia, which in simple terms is hair loss. What is it and what causes it? Well, to talk to us about it is Dr. Bernard Gishina. He is a dermatologist. And I started by asking him, what is alopecia?
Alopecia is quite a common condition. And in simple terms, it means hair loss. And actually, alopecia is a Greek word that stands for baldness. And I said it's rather common because 1% of the general population at any given time, they are affected by alopecia. There are so many causes of alopecia. And when it comes to us, we want to divide them into different categories to make it easier for us, for diagnosis and management, and usually have two arms. One, we say non-scarring alopecia. And in simple terms again, non-scarring alopecia means the hair follicles are still intact and their probability of hair regerminating. And if we talk about non-scarring alopecia, some of the causes include infections. And we can talk of fungal infections. Like for our children, they usually get mashiringis. We call them tinea capitis. It's one of the causes. There are other infections, yeast infection, like seborrheic dermatitis. We can get bacterial infections that also can cause hair loss. Apart from infections, there are some medications that can cause hair loss. We have seen some of our relatives and our friends, when they have conditions like cancer, they are given some medications and actually they end up with hair loss. Yeah, that is a part of non-scarring alopecia. We have autoimmune conditions. One of them is alopecia areata. Again, a very common condition. Yeah. The other cause, we have conditions like genetic. There are people who get kipara, that is, we call it androgenic alopecia. It's pre-programmed, and you find it in families where people end up with baldness. Those are some of the causes of non-scarring alopecia. When we come to these other arms of scarring alopecia, we have again several conditions that can bring about the same. Starting from infections, we can have, or I'll start with very common things, trauma. If you get an injury to the scalp, most of the time, maybe you are hurt, you have been cut at that area, you are not going to get your hair back. There are people who will get some bacterial infections. We call them condition like folliculitis. Those are boils on the hair and on the hair follicles. Yeah, there are other conditions like dissecting folliculitis, where you have extensive infections to the hair. That is, you can get a condition like carrion. Carrion is you have fungal infection with secondary infection. Then we have other conditions like inflammatory conditions. There are quite a number. There are people with lupus. There is a condition called discoid lupus. Discoid lupus erythematosus, again, not very common, but it's there. We have other conditions like very common with our ladies, traction alopecia.
So having explained to us what causes alopecia, how then does it present itself, like the signs and symptoms of alopecia?
Hair is part of the skin, and we remember that we have specialized cells that deal with hair growth. And there are three different stages when it comes to hair. And in terms of those stages, One of the stages is the longest one. This is during the growth of hair. It can go from up to 6 years, from several months to even up to 6 years. Then there is a stage where the hair, those hair follicles, naturally, they start dying off. You know, all our cells actually, they're in different stages of life. So that stage takes about 2 to 3 weeks. The hair follicles and the hairs are dying off. The hair follicles shrivel, and at the end of the day, the hair comes out. Then there is a stage that we call the resting stage. It's called telogen, and again, it takes several weeks. And so usually our hairs are either in those 3 stages. The stages where they are growing, the stage where the hairs are almost dying, and of course the stage where they are just resting. Yes. Okay. So in case we have any challenge in any of those stages, definitely we are going to end up now with hair loss. Yes.
So thank you so much, Dr. for that explanation. So what causes alopecia?
Okay, now again it will depend with the cause. For most of the infections, of course, somebody will come off maybe with that mashiringi. Somebody will come with those boils on the scalp. Somebody will come with an other condition on the body. Actually, I never talked about so many other conditions that can bring about hair loss, like thyroid disease can present with the same. But majority of patients actually, when they get hair loss, they don't have any symptoms. And maybe somebody will just comment, I've noted either I'm getting a lot of hairs on my bed, or somebody will just know, I've noted a bald on your scalp. But some people will have maybe a condition like itchiness on the scalp, some pain, some stinging sensation on the scalp. Those are some of the symptoms that people come up with, yes.
So alopecia, like you said, is a loss of hair, and you've rightfully explained to us how it presents itself, the signs and symptoms. But which parts of, can I say, the head especially, are affected by alopecia?
Okay, again, different conditions present with different presentations. And again, there are areas of areas where some conditions present themselves with. Like, for example, somebody with balding, for the male sex, most of the time actually you start from the vertex and going to the bitemporal area. Yeah, for ladies, a little bit different, but again, it also starts from the frontal aspect. Then the hair regresses to the back. So different conditions comes with different. Yeah, there is one condition, of course, traction, that is very common again in our ladies.
You know, for very women after childbirth, they normally experience hair loss. Can that be termed as alopecia, or again, what causes it?
Very interesting. Again, remember we said there are so many other conditions that can bring about hair loss. Any form of stress, childbearing, severe infection or illness, loss, maybe a loss of a close persons. All those things actually, they affect the way the hair, they affect our hair from different stages. Now, for example, when you talk about mothers who are breastfeeding, they had maybe during pregnancy, they had very nice hair. Then within 3, 4, 6 months, they notice that their hair is shedding off. Yeah, that trauma of childbirth will affect so many hairs, and what happens around that time actually, because of that trauma that happened about 2 to 6 months before, at that point your hair just starts shedding off. Yeah, the beauty with such conditions, it's temporary. It's part of the non-scarring alopecia. Most of the hair, if taken care of, will just come back.
You know, for us ladies, most of us use hair products, and even there are certain practices like braiding, that sometimes you can experience some hair loss. So is it okay to say that there are certain practices that can actually cause hair loss?
I'll talk to that with another condition that is a little bit rather common in the dark skin for us people, and traction alopecia, and another one that attacks ladies from their 40s, 50s and above. It's called centrifugal cicatricial alopecia, now with traction alopecia. And both of these, you find that it's just the pulling of the hair as we are braiding our hair. It causes an injury, and it's a progressive injury. And most of the time we keep on losing hairs. And sometimes we destroy our hair follicles, so that most ladies who have traction alopecia, to get back your hair, it's very difficult. It's very challenging for us as medical health providers. Yes. Now, other things, like now I'm talking about that other condition. There are, apart from traction, there are other things that we do on our hairs, and of course they have adverse effect on our hair. Ladies, we like using chemicals frequently. Again, they cause some irritation. Those chemicals, either hair dyes or these other chemicals as we are making up our hairs, at the end of the day, they cause irreversible damage to our hair follicles. The drying process that we do with our dryers, the hot dryers, yeah, again, they cause irreversible damage to our hairs. One, when we are braiding our hairs, it's good to avoid tight braids. If we are talking about use of chemicals, those one you can slow down on their use. You don't have to do them very regularly. In terms of dryer or drying your hair, you can do it naturally, yes. Or instead of using those heat dryers, there are cool dryers that you can do slowly without much damage to your hair and to your scalp. Yeah.
So what are the treatment options for somebody who is experiencing hair loss?
So before you talk about the treatment, again, it's good to visit a dermatologist. That's somebody who is trained in matters hair, so that at least they can be able to say this is an infection, this is lupus, these are thyroid disease. There are tests that can be done to confirm if there are other conditions that are bring about the hair loss. Now, in terms of treatment, it will depend with the cause of the hair loss. If it's just an infection, just treat an infection. If it's an allergy, eczema, just treat that eczema. If it's psoriasis or whatever it is, just treat it. So that is number one. So identify the cause and treat the cause. In case, again, you need again to set your target before you start treatment. Because if somebody has scarring alopecia, most of the time it's very difficult to arrest and already hair condition that have already happened. But what we do is we need to stop it from progressing on. Yes, it's very, very important. Yes, of course we need to counsel our patients, just not write a prescription. We need to counsel them, talk to them about their expectations and what you are going to get at the end of the day. So some of the treatment options, apart from the cause of the condition that is bring about the hair loss, there are creams that we do prescribe, steroid creams, non-steroid creams that we apply. We can give some anti-malarial medications for treatment of hair loss. There are some antibiotics that we can give. And sometimes there is also the use of, we can use hair transplant, that is surgery, in terms of hair, taking care of hair. Of course, things like wigs, they play a very big role for people who will never get their hair back. But sometimes we do tattooing on where somebody has lost, like somebody have lost the eyebrows. What do you do about them? Tattooing is still part of management.
How important is diet or lifestyle change, for that matter, when it comes to maintaining a healthy scalp or healthy hair?
That is quite a challenging question. And because again, people will talk about marketers, let me use marketers, whatever kind of marketers, they talk about so many products that are there in the market to make your skin to be better, to grow your hair to be long and all that thing. But in medicine, we talk about scientific evidence, and most of them, they don't have any scientific evidence. But what we know is most of those micronutrients, and there are some medications that we know they have micronutrients like the B complex, the zinc, and the others that I mentioned above, that they have a role in terms of making your hair strong and making your hair healthy. So, and most of them you are going to get them maybe from fruits and vegetables. Very, very important for our food. And my advice is we need to stop going for those shortcuts, the YouTube and the rest, Google, because most of the information that is there, it's not scientifically proven. But remember, at the end of the day, in terms of any hair disease, hair loss, the most important thing is you need to go and find out the cause of this hair loss before you treat it. Okay. Yeah. Again, it takes some time. And as I'm saying about those 3 stages of hair growth, in terms of growth, it can take from several weeks to several months. And some of the medications, actually, we say some people can use them even up to 6 months before you see those very good changes. Yeah, because again, hair in different parts of the body grows differently.
So there are people who have, different colors of hair. You might find somebody has, white hair, but majority of it is black. Some people have brown hair. What causes that?
Again, very, very interesting questions, because unfortunately for masses, when you see somebody has a particular hair color change, we tend to blame this most likely this one has HIV, this other one has A, B, C, D. On the contrary, there are so many things that determine our hair color. Of late, we are seeing so many people, even from young children, who are getting premature graying of hair. Yeah. It's very, very common. And so some of those things, they are genetics. Even the color, how your hair looks, it's mainly it's determined by the genes. Yes. So some of these conditions, you find them in the family. Yes. So before you skip to judge somebody, you need to ask yourself maybe a question. Yeah, so those are the factors that can make different color changes. Okay. Yes, so, and also we have some medical conditions, like in young children who have conditions like deficiencies, like say kwashiorkor and marasmus, and of course they are going to have their own kind of hair changes.
People as young as 18 years are now having baldness. Does it mean that it can affect people of any age? Because the belief was baldness only affects older people.
In terms of, we call it androgenic alopecia, it's genetically pre-programmed. That's why we get it, even that is baldness. But again, there are conditions that will mimic baldness. There are people who will get alopecia areata. There are different categories of that condition. It's an autoimmune condition where you get the baldness, and you can get it almost the entire scalp. It can disappear from the scalp, from all the other hairy sites in the body, and you might think it the androgenic, that genetic hair loss. Yeah, so those are totally different conditions. But for people who have the baldness, most likely there is family history of baldness. Yeah. It's we call it patterned hair loss because it follows a pattern. Yes. Yesterday I met a young man. He was 18 years old and he was very much worried. So it can happen very early. But I know the dad. The dad is bald, the entire scalp. He has another brother who is not affected at all. Yeah. And the uncle, especially from the mother's side, all of them, they have baldness. So I just reassure. Yes, it can happen as early as in the teenage years. Yes. Okay. Yeah, when it comes to Medicare, I think the best thing for whatsoever condition that somebody has, it's good to talk to the right specialist. And the beauty in Kenya, we have so many specialists. So if you have issues with hair, go to a skin specialist. If you have issues with any other conditions, look out for that specialist and they can be able to sort out your condition.
We are indeed grateful to Dr. Gishina for that elaborate discussion on alopecia, hair loss. And I hope that back at home you've learned a lot in as far as what causes hair loss and how you can prevent it. So we hope to see you again next week. My name is Marie Yambo.